Hi, we are Team Quebec, and in this video we will be talking about PICO and how it is used in evidence-based dentistry. An essential part of evidence-based dentistry is developing a clinical question prior to performing a literature search on various treatment plans for a particular patient. PICO is an acronym used to develop a well-built clinical question, which will thereby help the clinician focus his or her literature search.
PICO is an acronym in which the P stands for patient, problem, or population, the I is intervention, which is the main treatment plan considered, C, comparison, that is comparing the intervention to an alternative treatment or the intervention itself, O is the outcome, which is what you are trying to achieve or improve. Once the clinician is able to recognize all four components, he or she will be able to construct a well-built clinical question. Let's consider the following scenario. Ralph, a 38-year-old jockey who usually races in Saratoga in the summertime, is concerned about his oral hygiene. He asks you if switching to a powered toothbrush would be better than using his manual toothbrush because some people were discussing that in the stables, and he wondered if the horse hygiene correlated with the humans. Let's construct a clinical question using PICO.
So what is the problem or population in this case? Considering Ralph is 38 years old, we will say that in this particular case, we are focusing on adult patients. So the beginning of our clinical question could start off as for adult patients, ... What is the intervention in this scenario? So the intervention is the main treatment plan considered. So in this case, it would be the use of a powered toothbrush. So by building off of our clinical question, we would have for adult patients, will the use of a powered toothbrush, ...
What is the comparison? So in our case study, we are comparing the usage of a powered toothbrush to the usage of a manual toothbrush. So now our clinical question would look something like this. For adult patients, will the use of a powered toothbrush compared to a manual toothbrush, ... Obviously, our clinical question is not complete. We still need to state the outcome we are hoping to achieve or improve. In this case, we want to know if Ralph's oral health will improve when he uses a powered toothbrush versus a manual toothbrush. That can be measured by a reduction in plaque or gingivitis.
So by incorporating the outcome component of PICO, we get our fully formed clinical question. For adult patients, will the use of a powered toothbrush compared to a manual toothbrush result in reduction in plaque and/or gingivitis to improve oral health? We hope our video was both helpful and informative on how to apply PICO to construct a well-developed clinical question. Thanks for watching!